Good afternoon, everyone. I'm Dr. Varun Damble, and these are my colleagues, Dr. Roshan and Dr. Peshal. We are from College of Medical Sciences at Bharatpur, and we are the first batch of DM students of the Department of Diabetology and Metabolic Disorders. So this is an interesting case which we would like to tell you all about today. So she's a 47-year-old female who 14 years back had complaints of increased frequency of micturition, increased thirst. That is how she was diagnosed to be having high blood sugars, and 14 years back at some center she was misdiagnosed as having type 2 diabetes, and she was started on oral tablets for her diabetes. However, for 14 years while taking these tablets, her diabetes was never under control and her quality of life was poor. About a month back, she came to our center. She was referred to our department with complaints of high blood sugar levels. When we took her careful history, what we found out was there was no family history of diabetes. So a diagnosis of type 2 diabetes really didn't make sense since there was no family history or no genetic history. So then we went in a little detail, and what we found out was her C-peptide reserve, which is the pancreatic beta cell reserve, was poor. So what we found out was her pancreas is not producing enough insulin. Then we evaluated her case a little further. We got her USG of the pancreas done, which had a dorsal agenesis of the pancreas. That means the head and tail of her pancreas is absent. Only the head is present, the tail and the body of her pancreas is absent. Hence her body is not producing enough insulin. That is her main defect. So we had to change her treatment. So from the oral tablets, we had to change her to give her insulin 4 times a day, to which she responded very well. So our message to everyone is don't blindly diagnose, because once you have the diagnosis, it stays with the patient lifelong. So there are about 78 different types of diabetes which are present. It's not just type 1 or type 2 diabetes. So let us try and practice precision diabetes.
नमस्ते, मेरो सुगर 14 वर्ष भयो। सुगर सुरु भएको कहिले पनि कन्ट्रोलमा थिएन। अहिले पनि म यहाँ पथरीको उपचार गर्न भनेर आएको। मेरो सुगर एकदम बढेर मैले डाक्टरसँग यहाँ सल्लाह लिएँ, गरी देखाउँदाखेरि उहाँहरूले इन्सुलिन चलाउनु भयो। अहिलेसम्म इन्सुलिन चलेको थिएन, अनि उहाँहरूले रोग मेरो पत्ता लगाएर इन्सुलिन चलाउनु भएको छ। त्यसैमा म खुसी छु। जसरी हुन्छ मेरो सुगर कन्ट्रोल र राम्रो भइदिए हुन्छ, यति भन्न चाहन्छु।